Hello, again, my name is Addie Dawn, and this is part 3 of a video about what would happen in a psychiatric facility. Just a reminder again that I've worked in the psychiatric field for 20 years and have worked in psychiatric hospitals, so I want to give people an idea of what they can expect and not to be so fearful of the whole process. What I would like to do, I think, in this video is more or less a continuation of the last one and talk about a typical day, hour by hour, of what you can expect. And then, if time permits, of course, I'll go into restraints and seclusions, but probably do that in the next video. The typical day, as I said, you would come onto the unit and basically you would have a room. Now, I'm going to talk about one of the facilities where I worked. Each patient had their own room. It was small, but they had their own room, and they would share a bathroom with another roommate across the bathroom hallway. And so basically, individuals can get up anywhere from 5:30, 6 o'clock, or later, and get ready for the day. The facility where I worked, they preferred that you did not wear your hospital gowns all day. They wanted people up and dressed and ready in street clothes before breakfast, although some people, would take a shower after breakfast. Basically, breakfast was at 8 o'clock, and until breakfast, a lot of people would get their vital signs. Everybody has to have their vital signs when they get up. And by 8 o'clock, breakfast was served, and like I was saying before, the food at this particular facility came up from another dining hall, so by the time it got to the unit, it was kind of cold, and so I wouldn't say this facility had the greatest food in the world, but it certainly had excellent doctors, and I definitely can vouch for that. After 8 o'clock, there would be a smoke break, and then after the smoke break, some minutes or time would be spent until the meds were given out at 9 o'clock. People would go up to a med window and get their meds at 9. And 9:30 would be a community meeting, at which time patients would give their goals for the day, what they'd like to accomplish, discuss any community issues, like, for example, well, the dryer isn't working very well, can we get that fixed, or, little things like that. And the program directors on the unit are really good about getting those things done. And then about, after the community meeting, they do a little stretch time if people wanted to stretch a little. And 10:15 was another smoke break. 11 o'clock would be a group, perhaps a discussion group with a psychotherapist or an art therapy group. The pharmacist would come up once a week and discuss the medications. Sometimes the residents would do a group, or a med student would even run a group, an informal group. And then at noon would be lunch. 12:45 would be cigarette time again. About 1:15 would be another group till 2 o'clock. Then sometimes there'd be a little break, and maybe there'd be another group at 2:15 or 3 o'clock. And then 4 o'clock, the TV was allowed to be turned on again, so the patients could watch the news, watch shows, do whatever they like. It kind of was a relaxation time for them, because by then the evening shift was on and the day shift was going off, and a lot of the hubbub of a lot of people being around would die down, and the patients could relax more. And so after 4, about 4:15, they'd have another cigarette break, and they had a courtyard where they could go downstairs. The unit was locked, but a tech would unlock the unit. They'd go down a stairway out into an open courtyard that was fenced in, but a really nice garden-like courtyard, so even the non-smokers would go out for some air. And then basically after the smoke break, 5 o'clock would be dinner. Certain nights of the week, weekends, and a couple nights a week, there were visitation hours from 5:30 to 7, and then another smoke break. So you see, they have to have the smoke breaks. They are given. The cigarettes are held by the staff. The lighters are held by the staff. Each patient gets 2 cigarettes for each time that they go down to the courtyard. And then about sometimes after the cigarette break, they'd have an NA meeting come in, or an AA meeting, and it would be a person who would come and just talk to the patients and share their story and help those who had any addiction issues. Then about 8:30 would be wrap-up group, 8:15, 8:30. That would be where the patients would gather again and discuss how they achieved their goal for the day and any other community issues. About 9 o'clock, meds would be given out, and that was an interesting time because every patient is on some form of sleep medicine, just about every patient, because of the agitation, because they're coming in states where it's difficult to sleep. So that would be given out, and usually they'd fall asleep after 9 o'clock. A lot of them would go to bed, unless it was a younger group. And when we'd have a younger group on the unit, they'd stay up, because they could stay up till 11 o'clock during the week, midnight on Friday and Saturday night. And so after the bedtime, it was like watch TV time for most of them and then go to bed. They had to be in bed by 11 or 12, not allowed out of the rooms till 6 in the morning. So that was basically how the treatment day would operate. Checking my megabytes here. I think what I'm going to do is I'm going to save this discussion of restraints, seclusion, and some other issues for the next video. Thanks a lot.